Gentlemen, imagine waking up tomorrow with a level of firmness you may not have experienced in a long time. No medications, no devices. And no risky approaches, just your own hands and a few minutes of focused, precise stimulation designed to activate your body's natural erection response. I'm a qualified medical professional with many years of experience helping men restore sexual vitality. And today you'll learn about 3 specific pressure points on the penis and surrounding area. The T may help bring back morning erections by enhancing blood circulation, easing the correct muscles, and improving nerve responsiveness. If those automatic morning erections have been missing, stay with me, because by the end of this video you'll understand exactly where these points are located, how to stimulate them safely, and how frequently to do so for meaningful results. Before explaining where and how, it's important to understand why this approach works. Once the underlying science is clear, you'll realize you are not simply touching skin, you are engaging one of the most powerful systems in the male body. Erections are neither random nor purely mechanical. They occur through a carefully synchronized interaction between the brain, spinal cord, blood vessels, nerves, and muscles. The process begins with nerve signals, tiny electrical impulses that move rapidly from the brain or sensory nerves to the erectile tissue. These signals instruct the smooth muscles inside the penis to relax, allowing blood to flow in and fill the spongy chambers known as the corpora cavernosa. As these chambers expand, the veins that normally carry blood away are compressed, trapping blood inside and creating firmness. With time, this process can change. Blood vessels in the pelvic region may lose flexibility as the arterial walls become less elastic, a process often accelerated by long-term strain, low-grade inflammation, or conditions such as elevated blood pressure. At the same time, nerve conduction can slow, meaning those electrical signals from the brain or sensory receptors may not travel as quickly or as strongly as before. This combination of slower circulation and weaker nerve signaling is a major reason morning erections often fade after the age of 50 or 60. Targeted pressure point stimulation works because it delivers an immediate activation signal through the nervous system. When specific points are pressed or massaged, clusters of sensory nerve endings are stimulated, feeding directly into reflex pathways involved in erection control. These signals do not remain local. They travel to the pelvic nerve network and up to the sacral region of the spinal cord, where erection control is centered. This sets off a chain reaction in which smooth muscle relaxes, arteries widen, and blood flow increases. In addition, certain points directly influence the pelvic floor muscles, the supportive muscles that help maintain firmness and regulate ejaculation. Stimulating these muscles can improve their tone and responsiveness, making it easier to maintain firmness once an erection occurs. This is why pressure point work often has a dual effect. It can help initiate erections more easily and also help sustain them for longer periods. By applying pressure to the correct areas, you are essentially bypassing some age-related slowdowns and providing the erection system with a direct, hands-on stimulus. It's similar to resetting a system, reducing lag, refreshing signals, and allowing different components to work together smoothly again. When practiced consistently, this stimulation can help retrain erectile reflexes, improve blood vessel flexibility, and enhance nerve sensitivity over time. The first point to focus on is located at the base of the penis, right where the shaft meets the pubic area. To locate it, slide your fingers along the underside of the shaft toward the body. You may feel a subtle groove or indentation, similar to a natural hinge where erectile tissue connects to deeper pelvic structures. This area can feel slightly firmer or more textured because it is a convergence point for important anatomical features. This spot is significant because beneath the skin lies a dense network of sensory nerve endings along with key blood vessel junctions that supply the erectile chambers. It acts as a control center where nervous and circulatory signals meet. Stimulating this area encourages clearer communication between the brain, spinal cord, and penis. When you apply gentle, intentional circular pressure here, you send two messages at once. One tells blood vessels to open and allow more flow, improving circulation. The other prompts nerve fibers to become more alert and efficient in transmitting signals. This prepares the erectile tissue to respond more quickly when arousal signals occur, whether in the morning or later in the day. To perform this correctly, Place your thumb over the groove while your fingers support the back of the shaft. Use moderate pressure enough to feel the underlying tissue without causing pain. Make slow, small circles, allowing warmth to build gradually. If the tissue begins to soften, you may gently increase pressure. Sensations such as warmth, light tingling, or fullness indicate improved blood flow and responsiveness. If these sensations are subtle at first, consistency matters. Daily practice increases sensitivity and effectiveness over time. For optimal results, this area can be worked on daily, ideally in the morning when the body is relaxed, or during a warm shower when heat has already improved circulation. Over several weeks, this focused technique can help retrain erectile reflexes and support the return of stronger morning erections. The second point is not on the shaft itself but in a commonly overlooked area between the scrotum and the anus. This soft, slightly springy region plays a major role in erection strength and control because it lies above an important pelvic floor muscle responsible for maintaining firmness by limiting blood outflow during an erection. Over time, this muscle can weaken if it is not engaged regularly, making erections harder to sustain. Applying targeted pressure here can reflexively activate this muscle, providing stimulation without performing full pelvic floor exercises. To find the spot, sit comfortably or lie back with knees slightly apart. Using two fingers, press gently yet firmly into the center of the area. Move your fingers in slow, controlled circles, maintaining steady pressure. You may notice warmth spreading toward the penis or a subtle pulsing sensation as circulation improves. Spending 2 to 3 minutes here can help awaken pelvic muscles and enhance blood flow. The third point is located just beneath the head of the penis, along the ridge where the head meets the shaft. This area contains a high concentration of sensory nerve endings responsible for transmitting arousal signals to the spinal cord. When stimulated with balanced pressure and rhythm, nerve responsiveness increases, making it easier for arousal to progress into a full erection. This area responds best to controlled stimulation. Using your thumb and forefinger, gently hold the ridge, applying light pressure for about 5 seconds before releasing. Repeat this pattern for roughly 1 minute, keeping the pressure firm but comfortable. Then switch to slow circular motions around the ridge for another minute. This approach helps activate sensory pathways, without overwhelming them, encouraging clearer communication between the penis and the brain. With consistent practice, this type of stimulation can support stronger and more frequent morning erections and may enhance overall sensitivity. The goal is gentle reconditioning, reminding the body how effective blood flow and nerve coordination should feel. The best outcomes occur when these 3 points are treated as part of one routine rather than separate techniques. Working them in sequence helps stimulate circulation, engage muscle support, and sharpen nerve communication together. Begin with the base point for about 90 seconds, then move to the pelvic area for 2 minutes, and finish with the ridge beneath the head for another 2 minutes. It's important to set realistic expectations. This is not an instant solution, and the body needs time to adapt and relearn coordination between blood vessels, muscles, and nerves. Many individuals notice gradual changes within a few weeks, such as improved warmth, fullness, and duration of erections. When combined with general healthy habits, these effects can become more noticeable and consistent. You do not need to accept weaker or disappearing morning erections as an unavoidable part of aging. The body retains the ability to respond when given appropriate stimulation and support. By working with these 3 points regularly, it is possible to encourage better circulation, improve nerve responsiveness, and rebuild morning confidence without medications or invasive methods. Sexual health reflects overall health, and steps that support circulation and muscle tone often provide broader benefits beyond intimacy. Subscribe to my Health Verse channel for more health videos.